Ricki. Vanity has undergone nearly 2,000 black market injections in her rear. Addicted to plastic surgery.
I got a rhinoplasty, a chin implant, a cleft.
Can we take a peek at what you've had done? Are they going too far?
As she rolled me over, I just saw a puddle of blood.
I think it's a miracle that you're even here talking about this today. What you need to know before having work done.
If somebody's coming back for repetitive procedures, it's a red flag.
Well, back to show us the hottest new procedures in plastic surgery is Dr. Ghavami, my favorite plastic surgeon. Thank you so much. Thank you, guys. Great to have you here. Thank you. Have a seat. Big kiss to you. Last year in the U.S., more than 1.5 million plastic surgeries were performed. That's a lot. That includes boob jobs, tummy tucks, nose jobs, eye lifts, pec and calf implants, and scores of surgeries you've never even heard of. Well, today is all about plastic surgery, the good, the bad, and the ugly. We'll meet a guy who is joining us fresh off his 54th plastic surgery procedure.
The most painful procedure, truthfully, facially, nothing hurts at all. No discomfort, bruising and swelling, yes, but no pain. My pec implants were the most difficult because they had to cut you under the arm and undermine all the muscle tissue and stick like the implant in through the armpit. And truthfully, I couldn't move my arms for a couple weeks. I had to basically go through rehabilitation to move my arms.
But it was worth it, you say?
It was worth it.
Okay, well, I want to bring in Dr. Ghavami into the conversation. As a plastic surgeon, would you ever cut off a patient who keeps coming back for more and more surgery?
I do it all the time. One of our jobs as a plastic surgeon is we're physicians first. On the first day of medical school, we take an oath that we do no harm to patients. So first and foremost is the health and safety of the patient. Safety also means mental health safety. So if somebody's actively going through a divorce or they're grieving the loss of a loved one, I don't even do surgery in that time period because they're not of stable sound in mind. And if somebody's coming back for repetitive procedures, it's a red flag to me. And I say no all the time because to me, I want my work to be natural. I want someone to be able to say, essentially keep me a secret and to not say that they had anything done. I just like to operate on patients who have a little bit wrong here or there or they're aging, and you do 1 or 2 procedures throughout their lifetime. More. Yes.
So in the case of Steve, I mean, not to put you on the spot, but is Steve someone, if he came into your office, would you turn him away possibly?
I actually would, yes. And I would actually try to ask him if he is seeing a counselor or a therapist to see if there's other things that are leading to these procedures that can be dealt with the root of the problem.
Up next.
You do not want to risk it by going to someone who's not certified by the American Board of Plastic Surgery. There's a right way to do things and a wrong way. You do not want to bargain shop for your body.
When they inject it in, they just inject it into, you know, the different spots that they map it out on your butt. And after that, you're supposed to massage it to get it round, shaped round. But the problem with that is it's a substance that's not supposed to be in you.
Wait, Dr. Ghavami, can you jump in about the butt thing? Do you do any of those injections?
Definitely not. The only thing that belongs injected into the buttock is fat, because the buttock already has fat. So you're putting fat where there's already fat. So the body accepts it, and it's from your own body. And the key is that for her procedure to remove all that, she's probably going to need a large incision to remove it, and then the skin's going to be loose, so she's going to need a buttock lift, so she's going to need her skin actually lifted upward. So it's a fairly complex surgery, but I've done it before, and you know, a lot of people are getting these bargain injections. They don't know what it is, and I've seen people with horrible complications that we have to do a 2- or 3-stage operation to reconstruct and rebuild them back to normal.
Wow, wow. Dr. Ghavami, do you see many patients like Melanie, stories like they went to other countries to get it done cheaper?
Yes, you know, this is a very important show because safety is so important, and you do not want to bargain shop for your plastic surgeon. This is your body you're talking about. It's a sacred temple. I mean, you do not want to risk it by going to someone who's not certified by the American Board of Plastic Surgery. Being certified by the American Board of Plastic Surgery is like a car having wheels. It's the basics. Beyond that, then you want to see how stylistic and aesthetic and how the work of that surgeon is as an artist. So you're always a physician first and a plastic surgeon and an artist of the body second. When you're going to another country like Colombia or South America, not that they may not have qualified plastic surgeons, but you don't know who's doing what on you. There's no laws, there's no regulations on it, and you have to leave that country to come back with all the possible risks. And they're
germs, even just traveling back home.
Yes.
You know, right?
I mean, I have a lot of people coming from Saudi Arabia, from outside of the country to visit me. I have, you know, princesses and foreign dignitaries, but they come and stay for about a week or two or longer until they know that they're finalized with their healing. And I have them go to recovery hotels where they have nurses. There's a right way to do things and a wrong way. You do not want to bargain shop for your body.
Thank you. Welcome back. Yes, sir. What's your question?
I want the opinion of the doctor about the implants to simulate muscles. Is that safe procedure?
You know, I don't do them. I don't believe in any implants other than breast and chin. I mean, for males, I wouldn't do that. You know, if you can't genetically build the muscle you want, then just, you know, that's something you just have to deal with. That's just the way God wanted you. But if someone's had kids and it's a woman and their breasts are deflated and sagging, they need a lift and volume filling with a breast implant, to me that seems more of a natural restoration of the body. To add implants, and as you heard from your guest, it's extremely painful. The breast augmentation I do on women, they're back to work the next day. I don't even prescribe narcotics.
Thank you. Yes, ma'am.
Do the plastic surgeons require their patients to go to counseling before they have the procedure done?
If I see red flags in a patient, they've had a lot of surgery, or I kind of find out about patients as I talk to them, what kind of life they have, if they're going through some trauma, some grieving, a divorce recently. If they're doing this during a divorce to make their husband jealous, I tell them, you know what, come back in 6 months when you are less of a hater. And, or, you know.
Thank you. Yes.
And how much time is there between their consultation and the surgery is scheduled? Do you make them wait a certain amount of time so they can think it over, or is it something that if a patient wants to have it done right away?
Unfortunately, my practice, they have no choice but to wait a little bit because I am booked up for a little bit. But occasionally I get patients from out of the country, and I'll talk to them over the phone or Skype consult, and I'll see them 2 days before the surgery. So that happens a little quicker sometimes.
But it seems to me like you're a unique doctor. Do a lot of doctors really sort of take their time with their patients? They have to keep their practice going, I'm guessing.
You know, I'll be very honest with you. The reason we're seeing complications like your patients is because we live in a greedy world. I trained as a plastic surgeon because I love the human body anatomy and I like the artistic aspect of it. You have OB-GYNs, radiologists, and anesthesiologists that were never trained to do this that now are getting less money paid by insurance companies, so they're scrambling to take weekend courses and try and finagle some kind of cosmetic skill that they were never trained in.
Wow, it is really a lot to think about. All I can say is I want your card for down the road. When it comes to plastic surgery, remember knowledge is power. If you are considering going under the knife, do your research, find a board-certified plastic surgeon, and ask the hard questions. I want to thank my guests, Vanity, Steve, Melanie, and Dr. Ghavami for being here. Hope to see you next time. Bye-bye.